Hello everybody, this is Dr. Haley, the Sports and Performance Doctor from Lyndhurst, New Jersey. I see a lot of conditions in my office, but one of the conditions I see time and time again is low back pain and dysfunction. And a lot of people come and seek the help of a chiropractor when they have low back pain and or dysfunction. In fact, recently, Consumer Reports just surveyed 14,000 of its subscribers, and they found out that 59% of them rated chiropractic manipulative therapy very highly satisfactory. So a lot of people see chiropractors for back pain and they're very highly successful. So what do I personally do when somebody comes into my office when they have low back pain? Well, I like to look at three things right off the bat. I like to look at postural alignment. I want to make sure all their spine and vertebrae are lined up properly. And we do this in a standing position, we do it in a seated position, and we do this as they're walking. We have a treadmill in the office and we can put them on a treadmill and watch them walking. Why is that important? Because we walk all day. We want to make sure we have good alignment. If you're an athlete, we'll put you on a treadmill and we'll have you run a little bit. That will show me how your alignment is when you're actually exercising. Second thing I like to do is I like to look at intersegmental motion. Not just global range of motion like you're bending over and touch your toes, although we do look at that, that's very important. We want to look at intersegmental motion. So every one of your vertebrae is moving the way they're supposed to move. And I do a technique called motion palpation where we'll sit you down and I'll palpate up your spine and put you through certain ranges of motion. Because if I find an area that's not moving properly, we call it a fixation or a subluxation fixation. And what that could do over time, if it's not corrected, it could wear away your joint and it could give you possibly a disc herniation down the line or some muscle imbalance. So you want to identify that early, and that's what we do. Third thing we look at is core stability or low back stability. I want to make sure you can engage in certain activities that you might be doing in everyday activities. So we like to do certain things like body weight squats, just to see if you can squat properly, just to see if you can lunge properly, just to see if you can stand on one leg. Can you stand on two legs? Can you bend forward? We want to see if you have some good functional integrity of the low back and the core muscles. Because if not, and you have a job where you have to move and twist and lift there all day, and you're not contracting your core and you're not working your muscles and you're not firing properly, you could have an injury, and we want to identify that right off the bat. So once I get those components out of the way, we have some more advanced diagnostic imaging in our office. We have x-ray. If you need x-ray, we can take x-ray, and a lot of times we do have to x-ray patients because we're looking for a degenerative process that might be underlying some major misalignments that we might be missing on our exam, and we want to see if they have maybe a disc problem. Sometimes we can see the disc height in the x-ray and see if they have a disc problem. We also have what we call a Insight Millennium Subluxation Station, which is a instrument where I could roll up your back and I can check the temperature coming out of your spine and see if your nerves are basically irritated right or left or both sides, or they're within normal range of motion. So that tells me the integrity of your nervous system. It also shows me on another component if your muscles are pulling. If they're too active as you're sitting down, are they pulling right to left? And that's very important because remember, we want a good alignment and we want to have good muscle balance. So once I get that underway and I have that kind of diagnostic protocol going on, we continue to do our orthopedic and neurological evaluation. After that, we figure out what kind of diagnosis we're dealing with and what kind of treatment plan you should have. How long is it going to take, and what are some of the things you need to do? Now, how do I progress you through my treatment plan, and what are the treatments like? Well, we do basic chiropractic adjustments, either with hand or I use chiropractic instruments in the office. For low back, we also have a flexion distraction table, which allows me to open up the interdisc space and loosen up the muscles and get you a better stretch in that low back vertebra that you might need. We also do a lot of different soft tissue techniques. We use a percussive therapy, and I use a lot of techniques that I learned throughout the years to help elongate your muscles and get out some muscle spasm and some adhesions and tension in your muscles and balance them out. Another thing we do is do some physical therapeutic modalities. We have electric muscle stim, we have cold laser, we have ultrasound. So we have a bunch of different things in the office. And then what we like to do is give you some kind of exercise, either in-house or at home, to basically stabilize the spine and work on your posture. So that's a multi-pronged approach to help you get to where you need to be and get you out of pain and get you functioning better so you can go on and live your life properly. If you need to come see us, my website is right underneath the screen right now, and you can give us a call, and we'd be more than happy to take a look at you and give you a thorough working over, and not a working over where we're going to beat you up, but a working over where we're going to find out where your back problem is, get you on the road to recovery so you can enjoy your life the way you're supposed to be. And just remember, don't wait till it's too late to see your chiropractor. Yours in health.